people, so for men and women, these are some of the things that you need to look out for. So if people notice that they've got a mouth ulcer and they've had it for more than 3 weeks and it's not going or it's getting bigger, that might be a sign of something like mouth cancer. The chances are it probably isn't. The chances are it's probably just an infection or something which will settle by itself. It might be a dental problem, but it's really important that you just get yourself either checked out by the dentist or the doctor. As I said, mouth cancer is quite common amongst Asian people, but probably more in Bengali people because they eat a lot of barn and the betel nut and they chew tobacco, and all of these increase the risk of mouth ulcers. So cough or croaky voice. Interestingly, lung cancer is quite a low incidence amongst Asian people. Again, I think it's to do with the genetics. And I also think lung cancer gets picked up quite early amongst Asians because when people present to the doctors with cough for 3 weeks, we've all got quite a low threshold of getting a chest x-ray done because, we want to exclude things like TB and things like that. So, if you've had a cough for more than 3 weeks and it's not getting better or it's getting worse, or you're coughing up blood or you're losing weight, those are some of the things that you need to go to your doctors for. I'm finished. Sorry. Change of bowel habit. I think there's been lots of advertisements on sort of, the billboards and TV about bowel cancer. So there's campaigns that are going on. There's bowel screening kits which come. They're quite complicated. My mum had to ask me how to use it. I think they're available in different languages, but they're basically strips of cardboard and you have to take a stool sample 3 days in a row and they check to see if there's any blood cells in there. Again, it's a complicated test and the number of my Asian patients who don't return that test is very, very high because they just think it's too complicated, I'll be fine. But it's really important. So go for your bowel screening and if you have any symptoms then you need to go to the doctors. And blood in stool, blood in urine, those things are important. And if you have a mole and it's changing colour or size, then you need to go to your doctors for that.